Welcome back to Let's Talk Health. I'm the host of kam'mwamba. As you know, on this program we talk about different health issues. So today we are here to talk about tuberculosis and then everything but you need to know about tuberculosis. As always, I'm always joined by an expert to discuss all the health issues. So may you introduce yourself?
My name is Frank Kennedy Mphasi, clinician. Yes.
So can you tell us what do you do exactly here?
You mean at the hospital?
Yes, at this hospital.
To conduct body rounds, conduct health talks, collect samples, monitor vital signs, offer psychosocial counseling, HIV counseling and testing, including daily morning handovers. Yes.
So when we say tuberculosis, what exactly does it mean?
Tuberculosis is a type of disease that is caused by Mycobacterium tuberculosis. It attacks generally in the lungs or in the airway. So in addition to that, we have got a type of tuberculosis that affect some parts of the body, except lungs.
What is this type called? The one that affects some parts of the body except the lungs.
Okay, we have got the pulmonary tuberculosis that affect the airway, and we have got the extrapulmonary that affect the organ of the person, but outside the pulmonary. Yes. Like TB spine. Yes.
So, alright. So, how can tuberculosis be spread around people?
It can be spread through air that contains droplets that contains mycobacterium from the infected person to an infected person. Yes.
So you told us about two types of tuberculosis.
Yes.
Which one type are there any other types?
No, we have got two: pulmonary tuberculosis and extrapulmonary.
So do you know the symptoms of tuberculosis like you mentioned two types. So can you tell us what are the symptoms of each type?
Okay, we have got many.
Yes.
One, we use cardinal sign. Number one, night sweat is a sign of tuberculosis. Weight loss is a sign of tuberculosis. Loss of appetite. Cough, dry or productive cough is a sign of tuberculosis, especially pulmonary. And extrapulmonary, some presents with a severe backache, abdominal pain, also are the signs of tuberculosis, because we have got also abdominal tuberculosis.
So you said the dry cough and productive cough. Can you explain further on this? What exactly
when I'm saying productive cough, when somebody is coughing, at the end they can produce a sputum that contain mycobacterium. So if you test the sputum, we can track the mycobacterium tuberculosis through the sputum. But some can present with cough, but without a sputum. So we say dry cough. There is cough, but without producing sputum. So when there is someone presenting with a dry cough, we can use chest X-ray to see the lungs if there is some consolidations or cavitations.
So let's say a person thinks they have tuberculosis. How are they diagnosed, or what tools do you use to diagnose the patient with tuberculosis?
We can use signs and symptoms, as I said earlier on, using cardinal sign. If someone presents with night sweat, within 2 weeks or a month, and weight loss, loss of appetite, dry cough, we can diagnose him or her to have tuberculosis. But others, we can use sputum for microscopy. As I said, we can take sputum from a patient, send it to the lab for AFB. We can diagnose tuberculosis, and we can use chest X-ray. If you can take a picture of a patient, some patient can present with cavitation on the lungs. Some present with consolidation on the lungs. But we have got also abnormal TB, which is very, very difficult to diagnose. It's easy to diagnose through laparotomy, exploratory laparotomy. Open the abdomen and see what is inside. We can also diagnose the abnormal tuberculosis. Yeah.
So, how do you open it? Is it a surgery or is you just use the X-ray?
You mean abnormal?
Yeah, you said it for you to open the abdomen.
Yes, we call exploratory laparotomy. Or to explore what is inside. So when somebody is having abnormal TB, we see the nodules around all the bowels, including the viscera like liver, spleen, kidneys, including uterus.
So the tuberculosis have a cure?
Yeah. We have got a drug. First line, we have got the RHCDE. We can give the patient the first 2 months and the last 4 months. And if the particular person detected through sputum, after taking drugs for 6 months, we take another sputum to confirm if there is a microbacterium or not. So it is curable.
So that wasn't medication. Do we have any side effects to it based on?
Exactly. Each and every drug has got side effect. So in TB drug, number one, when somebody started the anti-TB treatment, some present with peripheral neuropathy or numbness on the lower extremities. That's why we give RHZE, including pyridoxine, as a control of peripheral neuropathy, because it's given for the patient when they starting receiving anti-TB treatment. They present with peripheral neuropathy, almost 75%. Another one is jaundice. We have got the isonized drug. So the patient can present with eyes, yellow eyes, yellow urine, even color. So we call jaundice as a side effect of anti-TB drug. That's why when someone, before starting TB treatment, there is need to test liver function test, including renal test, before starting anti-TB treatment.
Or what happens in this renal test?
Renal test, we can use urine TB stick. We can use abdominal USS. So to rule out renal issues.
So I saw somewhere say that with active tuberculosis and maybe latent tuberculosis. So do you know what it means?
If we say active tuberculosis, that means someone is presenting with signs and symptoms of TB, and the investigations come out positive. So we diagnose him or her as active TB. If we say latent, That means first, it's like difference between acute and chronic. Acute is within or 3 weeks or a week. If we say a chronic, that means the condition is there more than 4 or more months or years. Yeah.
As you said, there are different medications for TB.
Yes.
So, may I ask, why is it important to take this medication?
It is very important because when someone is sick without taking medication, the transmission is high. The second one, he or she can die because of tuberculosis. So it's good to receive medication when someone has HIV, has TB, extrapulmonary or pulmonary. Yes.
So when taking this medication, to people thinking that, for example, someone has TB, they may be have malaria or HIV. So to this medication, pose a phrase like to be the other diseases like face that kind of diseases.
Yeah. For example, when someone has got HIV positive, he or she is prone to suffer TB because HIV weakens the immunity. So TB needs someone who has got lower immunity. All of us, we have got a TB virus, TB bacteria, but we are not suffering from TB because our immunity is stable. Yeah. Our body have got all the mechanism to fight against the infection. Yeah.
So, do you know any way that one can prevent TB?
Yeah. Preventive measures. Number 1, using mask. You can prevent TB. Number 2, avoid sleeping together with the TB patient. Number 3, prophylaxis. We use contact tracing. When someone has TB, we track all the relatives to receive the drug as a prophylaxis. As I said earlier on, all of us, we have got a TB bacteria, or sometime back we had it, but we didn't suffer because of our immunity. So we have got a prophylaxis drugs we give to the community, all those who assisted TB patients. So it's one way of preventing TB. Yeah.
So, let's say the patient has TB and they've been given medicine. Are there any lifestyle changes we should make or any lifestyle activities that they should avoid?
Come again?
When they are receiving medicine for treatment, are there any lifestyle changes we should make or any lifestyle activities that we should not do?
Yeah. When somebody is on TB treatment, first 1 month, if the TB detected through sputum, we advise them not go into the larger audience, like in the church, other congregation to prevent transmission. But after a month, transmission ceases because of drugs. Number 2, we advise them on a diet, well-balanced diet. As I said, when one is suffering from TB, is prone to malnutrition. So we advise on a diet. We advise them to test for HIV because there is a great relationship between HIV and tuberculosis. and 50% of patients suffering TB, they are suffering because of HIV, and we advise them to use mask, especially those who detected through the sputum, not detected through chest X-ray or thoracoramp X-ray. Yeah.
So you said one of the ways to prevent TB is to use mask. So,
Yes.
So can you tell how using mask helps to prevent TB?
The best mask to prevent TB is N95 only.
Oh.
Yeah, because in N95, you can prevent it to transmit and to contract. While other type of mask we prevent other bacteria, except Mycobacterium tuberculosis, according to the researchers. And we have got some mask inside. There is whitish and outside blue. If you have TB, you can use it to wear blue outside, white inside, for you to prevent to transmit. Because the white color inside the mask can trap the Mycobacterium tuberculosis. While when you turn out the white outside, it means you want to prevent it to attract from someone.
So does the tuberculosis have a vaccine?
Yeah, we have got a vaccine we call BCG. Yeah.
So what does BCG stand for?
When a child, because that vaccine is for children.
Yes.
When the child will receive vaccine, the body reacts to vaccine. So if the body reacts to the vaccine, the body produce antibodies to that can against for the mycobacterium infection. So if someone contracting mycobacterium infection, that antibody produced is the one that against the infection. That's why I said earlier on that each and every human being needs to have antibodies that fight against that particular disease. So the mode of action of BCG, partially, that's what I explained.
So you say BCG is for mostly children?
Yes.
So can I say like me or an adult? So do we have any vaccine or do we just have to take medicine?
For others, I said we have got prophylaxis, like 3-HP, isonized. So we give to the others as a prophylaxis, not a vaccine. But in children, we give a vaccine BCG.
So I heard that people with tuberculosis they get observed therapy. Yeah, so can you explain what observed therapy is?
If you say observed therapy, therapy is any type of I can say it's something that makes someone to cure or to prevent. For example, counseling is a therapy. One can cure through counseling. So counseling is a therapy. So medication is a type of therapy. That's why I said we have got so many types of drug. So drug is same like therapy. That's why we give drugs as a therapy. I said earlier on, counseling is a therapy. If any advice or preventive measures is a therapy.
So can you tell us, like the patient has tuberculosis. Can you tell us how can they protect their friends and families?
Okay. In the other way, that question is preventive measures. I said earlier on, using mask. Number two, if you have got a cardinal signs, I mentioned earlier on, nitrate, dry or productive cough is going to meet the health workers and test for TB. If you are on already TB treatment for the first 1 month, if the TB detected through sputum, avoid direct contact or avoid moving around without using mask, or avoid attending other congregations like church ceremonies, etc. You can prevent to transmit.
So, let's say when a patient has got treatment for tuberculosis, and they've been healed, can the tuberculosis come back or just after being healed, it's gone?
Thank you very much for your nice question. We have got MDR TB. If we say MDR TB, is multi-drug resistant TB. Many times occurs through the patients with poor drug compliance. TB treatment. A patient is supposed to receive drugs for complete 6 months. So when the patient started TB treatment, a month or 2 months, then they stop. They can make the mycobacterium tuberculosis to become resistant. That's why we have got MDR TB, we have got recurrent TB. So if you say recurrent TB, that means the patient already suffered TB. After completing the treatment, after some months or some weeks, again that patient present with the signs and symptoms of TB. When taking samples, you find the results come positive. So we call recurrent TB. We have got another type of patients. Started TB treatment with a good drug compliance, completed 6 months. When you take the sample for confirmation, you find that there is mycobacterium tuberculosis. So we call multi-drug resistance. That's why we have one drug resistance we call mono. 2 or more we call poly-drug resistance. We have got isolated only resistance. We have got rifampicin only resistance. So these types come in because of poor drug compliance. In the center of resistance, poor drug compliance. So each and every patient, before starting TB treatment, it's good to offer comprehensive counseling.
So as you can see, today we have discussed a lot about tuberculosis. We have learned many things about tuberculosis, and I hope all what we have said today will help you avoid and prevent tuberculosis. As always, this is the show health. I've been your host, Dr kam'mwamba, and I'm joined by
Frank Kennedy Mphasi.
Thank you very much, and until next time, this has been the show health.